Hi, I'm Dr. Michele Drake, and I'm here with Kenzie today, one of my favorite patients, and we're going to talk to you a little bit about dogs as they age and some of the things you may be noticing at home and things that we can help you with. So a lot of people, when they come in for exams with their older dogs, especially the larger breeds, of course, not so much in small breeds, but in larger breeds, people just start to mention that their dog may be slow to get up, or they may not even mention. It's usually when I start to ask, like, tell me about the average day in the life of your pet. Tell me what's been going on. They may mention that they're having a harder time getting into the back of the car or going up and down the stairs. So dogs, as they age, they do develop, many of them do develop arthritis, especially large breeds. They'll have problems with their knees, problems with their elbows, problems in their back, and then certainly problems with their hips too. And also in their feet sometimes too. So here's many places that dogs can develop arthritis. They're rarely going to tell you that it hurts. I have many clients that come in here and their dog's kind of limping, and they told me that the dog never cries out. Well, dogs rarely cry out unless it's something that just happened acutely, like if you just step on their foot. Otherwise, they're going to get used to the pain, and that's just how they're used to living, but it doesn't mean that we couldn't greatly improve their quality of life. So what we'd like to do is start out with a good history, just tell us what's been going on, a good thorough physical exam, because sometimes we find things that are a little bit scary, also like tumors and things, which we don't like to find those, but we can actually find those just in doing a physical exam, sometimes with the combination of x-rays also. So we're going to do a good thorough physical exam. We're going to watch your dog walk around. We're going to manipulate all the joints, and then we're going to probably want to take some x-rays if we do really feel like there's a problem. The benefit of the x-rays is it helps us to isolate where the problem is, and then it helps us to select medications and or physical therapies or other options, sometimes surgical options for the best quality of life for your dog. Some of the things that we have to offer, actually we have tons of things to offer, okay? So lots of things for pain control. We have the use of laser therapy and acupuncture, which are great sort of integrative opportunities for pain control, but we have lots of medical things too. And it includes supplements in addition to actually pharmaceuticals. So some of the supplements we use is Dasquin Advance. It has a combination of, as you can see, they are like flavored chews, and Kenzie is very interested in them. So they are very palatable, as you can see. And these are great. We recommend these for any large breed dogs, really, if they're really large breed dogs, even starting off earlier in their life. This can be a great way to slow down the progression of joint disease. But certainly if we have determined that they have problems, this can help with just keeping the joint surface as smooth and as less inflamed as possible. Omega-3s are great for just about everybody, for everything, but certainly for arthritis, they could be helpful, anti-inflammatory, and they're very safe, obviously, and it can be great. Some of the medications we like to use if we have diagnosed specifically arthritis, we want to use a non-steroidal. We have a combination of a couple options. Rimadyl is a great non-steroidal, and Gabapentin is another one that we use for some of the dogs that have, say, some other issues going on. We want to be even more careful with, say, the kidney or the liver. It's a little more expensive, but it does have a different spectrum, but also very helpful for arthritis. So these drugs can be really helpful for quality of life. So I know some people are really cautious about using any pharmaceuticals, but I always tell them what you may want to consider doing is just doing a 1-week trial of the non-steroidal, and if you can see a big difference in how your dog moves, then probably we're addressing a lot of pain for them by using a non-steroidal, and I think it's a good choice then at that point. Something else we may use if we are using these and we still feel like we have some pain, or if we've determined it's, let's say, a back issue, then in addition to the Rimadyl, we may want to use another adjunctive pain medication called Gabapentin, which can be great for neural pain. So nerve pain associated with the inflammation that's going on in a joint or a back or something. So this can also be helpful for some older dogs that are experiencing some issues with geriatric aging. So there's that, and there actually are a couple other medications. I'm just not going to go through all of them, but I just want to let you know that quite often what we'll do is we'll start your dog on some medications, and then we'll follow up a month later to assess and have, with your help, assess how your dog is doing so we can decide whether or not keeping him on that dose or that medication is appropriate, or whether we should switch to something else. Because just as with the humans, there's not a one-size-fits-all. There's not a one-size-fits-all for dogs either, and we can definitely improve their quality of life by working with us and working together as a team to find the best way to go.